much. Yeah, my name is Emmanuel, Gebreyes, second year medical student, and today I'll be talking about the hidden cost, how adverse childhood experiences impact health and prosperity. So just quickly before we begin, just to give a quick content warning that some of the topics that we'll be talking about today do involve some sensitive information. If you'd like to take a minute outside the room at any point, please feel free to do so. So just to begin, my project was submitted for an essay prize and looks at adverse childhood experiences. It looks at what they are, how they impact health, and what can be done to prevent the effects of these adverse experiences. So it looks at that from an individual and a societal perspective. The individual perspective looks at Miss X, who is a young person from Glasgow, who had experienced many of these adverse childhood experiences, and how they affected her and her upbringing. So that offers your individual perspective and the sort of poignant story that goes along with the societal perspective offered from research and the sort of current understanding of these childhood experiences. So what are adverse childhood experiences, or ACEs? So I've categorised them into three groups. So you have abuse, neglect and trauma. So different forms of abuse, neglect and trauma. So neglect emotionally could be not having that open relationship in the household, not being able to talk about the things that are happening in your life. Physical neglect can be things like malnutrition or obesity or lack of exercise. And then trauma could be sort of any difficult traumatic episodes within the household during childhood. So it's important to understand that these adverse childhood experiences are quite nuanced and should be taken with a pinch of salt, and that they overlap and they're quite complex. And it can be difficult to attribute one specific ACE to a specific health outcome, for example. Chose ACEs, as I'll refer to them as throughout the talk, because 70% of the Scottish adult population have experienced more than one ACE, and 1 in 7 adults have experienced more than 4 ACEs, so something that's really prevalent and important for the Scottish population. So implications on health. This is a graph that was formed from a Scottish Government survey of 2019. So you can see if we focus on obesity, for example, in the green, as the number of ACEs increases, the prevalence of obesity also increases. You can again see for accumulatively, all the negative outcomes increase as the number of ACEs increase. It's important again to use that pinch of salt that we were talking about earlier, and that one specific adverse experience is not going to directly affect obesity, for example, or cause you to have obesity. It's more that it increases the prevalence within that population. So when a parent experiences one, the child experiences one. This was a note taken from Miss X's experiences and also from research, and that there's a lot of generational parallels between the children of parents that have experienced adverse childhood experiences and the effects. So if, for example, a mother had experienced anxiety and depression from her upbringing, it is also seen that children like Miss X experiencing those same effects from the adverse experiences. So if we look at ACEs' effects on society and individuals, if we look at society to begin with, you can see it impacts education with an increased amount of ACEs, correlating with a lower amount of educational attainment and degree qualifications. That then affects earning potential of this group, and as we said with that graph, increased physical and mental health issues, and that obviously puts a strain on the healthcare system. It's important that we can target adverse childhood experiences as they are modifiable, and that you can prevent these ACEs from happening as opposed to other conditions that might be congenital / you're born with. If we look at individuals, so some of the things that Miss X felt throughout her childhood: an increased internal pressure. You have things going on at home, you put the pressure on yourself to do better in school or work or sport, and that can affect your relationships within the households, cause neglect or a loss of social relationships as well. And that again leads to less professional opportunities and mental health conditions, as we said earlier. So if we focus on Miss X a wee bit more, this is a timeline of some of the adverse childhood experiences that Miss X had throughout their childhoods. Again, to hone in that point, it's very complex. You can see how many different experiences one person's had. So when we're looking at a population, we obviously need to take that into account, and how we treat these ACEs and how we understand the development of the ACEs as well. So if we focus on now what can be done about these adverse childhood experiences, on a societal level to begin with, you can look at preventative methods and supportive methods. So preventative methods look at preventing these adverse childhood experiences from actually happening in the first place, and supportive methods looks at treating the people who've already experienced these negative experiences in the household. Preventative methods includes educating young people on what they deserve in the household, the standards that they should be looking for in schools, sports clubs, and with their family. Screening those that are higher risk, so you could look at people who are parents who have experienced adverse childhood experiences, looking at their kids, screening them early for ACEs. And that's seen in the Scottish Government getting it right for every child. They're increasing the exposure of the UN Children's Rights Charter to get those kids more experience of what they deserve in different environments. Supportive methods can be through social prescriptions, so that's like bringing networks together, communities together, like Glasgow Women's Aid, connecting the right people for the victims of different types of abuse or adverse childhood experiences to get the right help that they deserve, be with people who experienced similar experiences, connecting them together, and then of course medical treatment for the negative health outcomes that we're talking about earlier, things like depression, anxiety, and obesity. So if we look at an individual level, one main factor that we saw in Miss X's experience was resilience. So resilience can be thought of as the willingness to break free from an adverse experience, and it can be used as a focus to break out of these adverse childhood experiences. One thing, or rather the main thing that Miss X felt sort of fostered this resilience was positive relationships. So creating that positive environment around yourself, being with the right people, and that can extend to family as well, especially when you get older and you have maybe a bit more control on on the people around you, then you can also focus on that as well. The Centre for Child Counselling in California, America, were trying to foster this resilience in the children in their group. So through communication, encouraging trial and error, problem solving, fostering that resilience so that then if an adverse experience occurs, they can then overcome it as well. So what can you do? As an individual, you might have been thinking of someone who's experienced many of these adverse childhood experiences or experienced many of them yourself. So you can now go on forward if you meet a new person, thinking about if they've experienced ACEs, how that might affect them in their adulthood. You might be able to reflect on the people that you've met throughout your childhood or even adulthood, how these ACEs might have affected them and affected their upbringing and affected how they present now. Creating positive environments, so if it is for yourself, being with the right people, being yourself part of someone else's positive environment, and symbiotically you are both going to benefit from that, and you can both treat each other, if you like, with having that positive environment, fostering resilience, and that goes for if you have any young people in your life as well. That preventive support methods, so that's for basically any interaction with young people, preventing these ACEs from occurring, screening those that are higher risk, and then support for the people that have already experienced these adverse childhood experiences, looking at the negative health outcomes as well. Here are some of my references. Thank you very much for listening. Hope that was a good talk. Hope you all enjoyed that.